Welcome to Way2PACES. I am Dr. Ramesh, the founder of Way2PACES. In this podcast, I'm going to discuss about how to open the discussion in history taking after the brief introduction. I like to mention a brief scenario. 83-year-old Elizabeth Martin was admitted to emergency assessment unit with off legs and she had a fall. She has a past history of diabetes mellitus, seizure disorder and hypertension. Task: take history and discuss the management plan with her. After reading this scenario, the primary problems are off legs and a fall. Any presenting symptoms or any presenting complaints, the first question we need to know is how long, the duration. Don't miss to ask this because it got significant in terms of whether it's a chronic problem or acute problem, or is it getting worse if it is a chronic problem. So first thing is duration. In this situation, I came to know that you are having off legs, and can you please tell me how long you are having this problem? This is one way. If you don't know the scenario, if you are not keen to tell about the scenario or the presenting complaints to the patient first, you can even start with, can you please tell me what's happening? But if you be specific in terms of problems, that will save some time. So first thing is the duration. The next thing, we try to jump into various things without knowing what it is. So off legs means, are we feeling dizzy or giddy? And you mentioned about fall, and we'll try to link different things and try to be quick towards getting in the diagnosis because the time pressure is there. But that won't help. We have to be quiet and switch on us to the listening mode. The first 1 minute. Ask the patient an open question. Can you please tell me more about off legs? Can you please explain me about off legs? So what do you mean by off legs? And then don't interrupt them. They will tell in terms of, okay, this is the duration and I was doing that and this, everything they will tell. If they didn't, and again you can link on to the another open question. See, rather than asking dizzy, do you feel dizzy or giddy or anything like that, just ask them, can you please tell me what were you doing at the time? When did it happen? What were you doing? You mentioned about off legs. Can you please explain me more about it? So when you ask another question within the first 1 minute, always have to be open questions. Once you know the details of the problem, then you can put closed questions and I ask, so are you feeling dizzy? And then is it happening when you stand up from sitting position? And various other things. I mentioned in this podcast to switch on ourselves to listening mode for the first 1 minute. That doesn't mean you can't ask any questions within that. If you get answers what you wanted to ask, then you can jump on. Let's say 30 seconds or 40 seconds you can jump on. And also, I'm not telling practice with only open questions without asking any questions for at least 1 minute. I'm not telling that. I want to make it clear. When I say up to 1 minute, we will get most of the answers what we wanted to know when we let the patient speak and when we listen, and whatever question we ask should be open questions. I summarize. When you explore any clinical symptoms or presenting complaints, the first one is the duration, second one, open question, and switch on to the listening mode. When we need to ask more questions, do some open questions first before going to the closed questions. This will help us in terms of getting more information and to analyze them, and that will help to make a clear clinical diagnosis. Thank you.